morning, good afternoon, all my friends out there in TV land. This show is seen in so many different places. I don't know whether to tell you to get yourself a cup of coffee or a beer. So you have to take your choice, hurry up, get your pencil and paper, come and sit down. This one's for you. This is Senior Issues, etc. I'm your host, Vita Verdon, and our topic tonight is going to be, I have a good-looking doctor here, internal medicine. Now I want to tell you a little bit about this particular doctor. I happen to be very biased because she is my doctor, and I'm so happy about that. Now, how I met this doctor is years ago, I say like 15 years ago, I was a clinic member at Evanston Hospital in Evanston, Illinois, and she was serving her internship there. And I was fortunate, it was a blessing that I got her. At that time, I was signed up with a study group, and I had signed a 7-year contract, a very solid contract, and it was for hormone replacement surgery. Now, I didn't know whether I was getting the particular hormone or whether I was getting a placebo, but when I started with her as a doctor, she said, me being a diabetic, I am a diabetic, you all know that, you've known me throughout the years, if you've been watching the show, that I let you in on everything, I tell you everything. And she said that she didn't think that was good for me. Well, I couldn't get out of that contract, but good for her. She got me out of that contract because she was concerned about my well-being. That wasn't the only thing that happened. The next thing that happened to me is I was going to have some cataract surgery, and before I had the cataract surgery, I had to have a cardiograph of my heart. Well, when she examined those x-rays, she didn't like them. She said they were suspicious, so she called in a cardiologist, and that was my first time with the cardiologist. And what I end up, that they discovered that I had was 2 silent heart attacks, and we're going to talk a little bit about that, what that means and what the symptoms are. But first of all, I'd like you to meet her. And I know she looks too young and too good looking to be a doctor of this experience. I just have to insert one other thing, that then she went on to have her own practice, so I lost track of her. But one day within this, about a year ago, I was at my cardiologist, and he said, you don't, because I live in Libertyville, Illinois, and I was going to the clinic in Evanston, Illinois, and that's a distance of 25 miles there and 25 miles back. So he says, you don't have to go that far. The North Shore service is in Vernon Hills. And he gave me a list of doctors, and when I saw it, I said, that was my doctor. And that's how we reconnected, and I am so happy. It makes me feel so safe. But that's enough of me blabbing. Let's get right to her and find out. I know what you want. You want to get up close and personal. Dr. Susan Thomas, good to have you on the show. It's the doctor of internal medicine. First of all, I know they're real nosy because I've gotten to know them. We're doing this now. This is our 12th year. So let's hear a little bit about you.
Okay. Well, I'll tell you a little bit about my, my
personal life.
Personal life. Okay. I have 2 young boys. I have Lucas, who is 8 years old and in 2nd grade, and I have Carson, who is in kindergarten. And we are locally in the area, and so they're in school in the area. And actually,
you also have a husband, I assume.
I also have a husband, actually.
Well, it's our tradition on the show, Doctor, that you look in that camera, and we give them big smackaroos, not little pecks, but great big ones. Okay?
I've been recently remarried and also have 2 stepchildren, so Zachary and Spencer as well. So
you have a quiver full. So you have to give 5 kisses then. Okay. 5 of them. Okay, that went through. We got it. Okay.
Thank you.
So you can tell us more.
Okay. So I grew up in the Chicagoland area, and then I left for school. I left for college, and I went to college at University of Southern California. I did my undergraduate work there. And then I stayed on and did my medical school at University of Southern California as well. And then after I finished that, I actually came back locally to the Chicagoland area and did my internship and residency through Evanston Northwestern, which is now North Shore. And then ended up staying where I met you a little over, over 10 years ago.
It's over 10 years ago.
And then actually stayed on with them, but joined one of their groups in Vernon Hills and have been there ever since. So.
Oh, good. Well, the first thing I know that our viewers would like to know is a good explanation on what is internal medicine.
Internal medicine is one of the primary care specialties. And so I take care of patients starting at age 18 through the remainder of life.
So you don't exactly specialize to seniors, but a good part of your practice is with seniors, right?
Yes, yes.
And so internal medicine, that means that you are the primary doctor.
Right.
Right?
And take care of a wide variety of problems, and oftentimes are the initial stopping point for someone's problems. So to determine where to help them navigate the healthcare system to figure out where they need to go.
Well, you helped me navigate to get to a cardiologist. I know that was a real surprise to me. I'd like to talk about that a little bit, if you don't mind, well, maybe you could give us a definition what I call a silent heart attack.
Sometimes silent heart attack is when you don't have the classic symptoms of the crushing chest pains, the shortness of breath, or the intense sweating. Sometimes there can be no symptoms or things you may attribute to something else. And I know you had mentioned that the symptoms you thought were more just...
Well, what happened to me, I remembered the two occurrences that this happened. And I felt like, because I have had occasionally what they call a panic attack, if I'm confronted in a room with a lot of people, or if I'm under a lot of stress, I felt my heart beating very fast, but I didn't particularly feel any shoulder pains or any other symptoms, so-called, that they give for what men have. So it never really even crossed my mind that this was a heart attack. But I remember that after I had these two occurrences, that I was really sluggish for about 3 weeks to a month. It took me a recovery time.
And that oftentimes can happen, especially where they're not the classic symptoms in women and in diabetics. And so sometimes the diabetes, those classic symptoms of a heart attack don't occur. So sometimes it can be found at a routine screening at a later date, or done as a part of a preoperative exam where that can be identified.
Well, what would you suggest to a person if they don't know? What would you suggest that they do for precautions?
I think regular health maintenance or regular visits with your doctor for health screenings are important to try to pick up things or health conditions early and screen for things that you may not have had symptoms for.
And have that checked out. I know also, if don't you think, for a precaution, if a person is like, I should have gone to the emergency room, and I was stupid not to go to the emergency room, but I thought, oh, this is so foolish if they'll just say, oh, this is an anxiety attack. But don't you think that it's better to be safe and go and have it checked out, even if it is an anxiety attack? Wouldn't you recommend that?
Yes, if there's any types of any chest pains, I think it's best not to attribute them to indigestion or anxiety or panic or strained
pepperoni
muscle.
Pizza from the night before. Well, I know from all the exams I've had after that, it's not that I have damage to my valves, but I have a slight injury to the muscle itself. I don't know if that makes for a different kind of heart attack.
Actually, heart attacks tend to affect how can affect different areas of the heart. So sometimes they can affect the area around the valves. Other times they can affect the muscles. Sometimes they can affect the areas of the heart that have the electrical impulses, so it can cause irregular heartbeats, like atrial fibrillation or skip beats or palpitations.
Well, we're going to get back to this subject matter, but now it's time for what I call Vita's Pearls of Wisdom. The subject that I'd like to talk to you about is something that I talk to you about all the time. I know you probably get sick of me saying it, but when you take your vitamins, be sure you're taking your vitamins with some sort of food, or else you're really not getting the full nourishment that you need, because it needs some type of food value to release the properties in the vitamins. Now, there's something else I want to talk to you about that I think is a real important subject, and that is we're inundated from all the ads on television. I know there's different shows, Know the Cause, and diagnose this, and this is going to make you younger. This is going to take away your wrinkles. This is the fountain of youth. And the way that it's presented to us on TV is, if it is not a prescription, it's harmless. That is not the truth. The truth is, it's very difficult to diagnose yourself, and that to be truly diagnosed, it takes a full blood test and for your doctor to evaluate where your needs are. And if you just think, well, I need a little extra here and a little extra there, that could throw your balance way off. And the fountain of youth is using these little gray cells up here and being practical about it, and just, go to your doctor on a regular basis and follow your plan exactly what you need to do. And when you go into your doctor, I always recommend this: just take a brown bag, throw all your medications, all your vitamins, any kind of supplement you're taking, all your creams, everything. Throw everything in there and bring it to your doctor. And if she cannot diagnose it, or he in the office, they could have it diagnosed for you, that you could get a proper evaluation of what your balances should be. And unless you do that, you can throw yourself way off. Now, we've talked about this a lot, that as people, we're not getting older, we're getting better. And if we're getting better, we're the first generation that has brought in the baby boomers, that we've come from a minority into a majority, and we're the first generation that's living this long. So we don't have a generation ahead of us showing us, hey, don't do this, do that. We're pioneering this ourselves. So we really have to be practical about this and keep ourselves in the proper balance. And I know so much of it has to do with how a person is taking their medicine and what their medicine is doing for you. Remember, more, it doesn't mean it's better. You're better off taking everything to the doctor and just laying it out and say, what can I get less of? What can I do less? What will be better for me? And listen to what the doctor tells you how to do it. Because if you start listening to all these shows, you make yourself mashuggy. You know what that means? Goofy. It makes you goofy to hear all this, because they're conflicting answers that they're giving you, and it isn't for the benefit to make you healthy. It's for the benefit so they can make more money. So be smart about that and be practical about it, and just take what your deficiencies need. And you can't diagnose this yourself. You have to, this is why a doctor is a doctor. This is why you go to school for all those years. So pay attention, and you'll be a part of that breed that not only we're living longer, but we're living healthier. And we should be able to, with all the advances in technology, we should be able to do this if we are practical about it and we pay attention to what we're doing. Now let's get back to what the doctor has to tell us.
Well, I agree with some of what you're saying about bringing all of your supplements to your doctor, so that if you're taking any vitamins, that you can discuss those with your doctor and make sure that those don't interact with each other or any of your medications. Mm-hmm. Because I think that you would agree that the reason to take some of these things is to, or at least some of the herbal products, the point is to help and not to do harm.
Right.
So, and I think that exploring different avenues, talking with your doctor about different choices based on conditions that you may have or concerns that you may have, to find out and make decisions together about what may be best tailored towards your individual situation. So I think sometimes going to the doctor and writing things, bringing in your medications so that you know what you're taking, making a list to bring into your doctor about your concerns. And sometimes when there's major issues or topics that are more serious, sometimes it's helpful to bring someone with you to your appointment so you could have another set of ears to hear the information that you're given and ask questions that you may not think about. Mm-hmm. So,
I think another thing that's important too, that I try to pay attention to, is the time you're taking your medication, because it could be a pill bottle, but it doesn't mean that any old time. Like my Crestor, I know I have to take that just before I go to bed.
That's true.
And I have my glaucoma eye drop. I have to take that just before I go to bed. Other medication I have to take with food in the morning, some at AM and some at PM. And that, I think that's important, like the timing that you're taking it, because it gives us a certain balance in our system, don't you?
Definitely. And there's a lot of the medications are set, like thyroid medication, for instance, you're supposed to take first thing in the morning, and space it out at least an hour from other medications, or because that it can affect how you absorb the medicines, and not to take calcium at the same time as the thyroid medication, or for instance, like you mentioned, the cholesterol medicines, to take those at bedtime. Certain diabetes medicines have to be taken with food. I think that making sure you understand how medicines are supposed to be taken, and timing wise, and other restrictions that may be involved with a particular medication may help you get the most benefit out of what you're taking.
Now, like in the senior population of your practice, what do you see as most prevalent? Is it the heart? Is it?
I would say there are probably the top four are heart, diabetes, cancer, and emphysema or COPD. They're probably the top four that I see.
Now, how is it that you picked your type of practice that you want?
Well, initially, I think choosing internal medicine helps to narrow down. So, I mean, I tend to see more office, not surgical type procedures. And I would say, for the most part, internal medicine providers or physicians see a broad spectrum of problems. So
I know, like internal medicine, like you could diagnose something and advise a person go to a cardiologist, a person go to an endocrinologist,
right? And
you can you're like the signpost directing them. You can get this done. So you have to diagnose it.
And it's it becomes an important part to have as a part of the, say, healthcare team, especially in a person that has a number of things going on and may be seeing a number of different specialists, to have that sort of hub. And that's what I sort of think of as internal medicine or family practice.
It's like a hub.
It's
That's
a hub,
interesting.
Where well, certain things can be taken care of in that hub, but certain things with today's medicine are so complex that the specialists are required for the most up-to-date treatments. And to keep everything in track of what this specialist is recommending and what this specialist was recommending, and making sure that all of these different recommendations are sort of like the medications, not conflicting with each other, and making sure that nothing falls through the cracks. That's sort of my role.
I'm sure you've seen, since the time you've been in practice, that seniors are living longer.
Seniors are definitely living longer. I think that there was an estimate that there is going to be, I think, over 12% of the population over 65 within the next few years, if it hasn't already exceeded that. And so I think that the care of seniors is, and especially with the baby boomers, is going to become an ever more prominent part of healthcare.
Well, for ourselves, in our being that we're in our 12th season, this has been interesting, because when we started, we were very much a minority, and when we got our 501c3 status, we're still in the minority, and our mission statement, and it still is, to give a voice to the voiceless, because like my first couple shows that I had to beg people, practically get down on my knees and cry for someone to come on the show, because we were unheard of, and it was just, it wasn't in the book, and so no one knew how to act with it, and we didn't know how to act, and so we asked around, do you think a show like this will go? And people said, no, what are you going to talk about? And people don't live that long. But for some reason, it was just a sign of the times. It hit a nerve, and I think people are very much interested in their well-being and how should we handle this, And that's where the doctors come into the picture to help us to be able to live forever. So now, what would you advise for seniors?
Well, I think that part of the goal is to age well,
right,
and to try to find ways to prevent disease. And we talked earlier that I had some sort of rules to live by to help in that endeavor, and I think that part of the important message is that it's never too late to make a change, and that even small changes in these sort of golden rules can make a difference as far as a healthy aging. And those would be stopping smoking if you're smoking, exercise, and so physical activity. And I think that even can start with going for a walk on a daily basis, or any type of activity that fits your own particular needs. If walking is a problem, chair exercises, stretching, strength training, even with light weights, gardening. All of those can be different types of physical activity that can increase flexibility, can increase balance, and in the long term can help to age well. Nutrition. To aim for lots of fruits and vegetables, to try to avoid things like white pastas, rice, even if you're not diabetic. They're empty calories. Soda as well is something else that doesn't have much nutritional value.
Explain what an empty calorie is.
Something that calories, so something that can cause you to gain weight but doesn't have any true nutritional value, not any vitamins yes.
All right.
Alcohol is one of those other things that's sort of a empty calorie.
Yet
where
you hear it a lot. Have a glass of wine a day. I personally don't, because I'm a diabetic.
I think everything in moderation.
Everything in moderation.
I think is an important key. So, and something also that happens with aging is falls. And so using assistive devices and working on safety of your home is a important point. So whether that be using a cane if you're having trouble with balance, or making sure there's no loose rugs in the house or places to slip. And then
the loose rugs, I know after I had broken my femur and my hip, the therapist came in my house and took away any chairs with casters on the bottom, and any loose rug. She took them away from my bathroom, in front of my sink, and behind my door, because those are danger points.
Yes.
And you should check also on the little steps ladder if the caster on the bottom of it is secure, because that's what happened to me. It had fallen out, so it was off of balance, so I fell off of it. And that's something to check.
And then, little things like hand grips to, if you're going up a couple steps, like from say the garage to inside the house.
And grab bars in the bathtub.
In the bathtub too. And then the last of the rules to live by is learn something new every day. It'll keep your mind active.
And keep these little gray cells going, right?
Yes, yes. Yep.
Because an old dog can learn new tricks.
That's true.
Now, this is a question that I ask every guest that I've had on the show. Where's your passion lie? What benefit do you get out? Because we're advocates of volunteers. We're all volunteers here.
As far as passion with my practice with medicine is what I gain the most satisfaction from is helping people, and really making small changes, helping people open their lives to see that small changes can make a difference. And so I think just the rewards of seeing the improvement in people's lives.
Right.
So.
Well, on the basis that I've had you on, the next visit would be 2021, but let's not wait this long. Let's renew it every year so you can keep us up to date on what's happening, because the 10-year lap in the between time is too long for us, and I want to keep the whole body covered. And you're the best doctor in your field that I know, so I'm always bragging about you. And now you know what time it is. It's time for me, first of all, to give you another tip. And the other tip is, as winter and the holiday is approaching us, we all want a sense of community. And you know what you do? You reach out to someone less fortunate than yourself. During this Thanksgiving season, you know what we should be thankful for as seniors? We should be thankful, number one, that we're alive. Now, when you come to the end of your rope, you know what you do? You tie a knot and you hang on. You know why? Because the best is yet to come. And we want you all to catch the spirit.